Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates.
Now let's look into the humoral regulation of the BP. So in case of the humoral regulation of BP, it includes the vasoconstrictors. So before that, the humoral regulation, it includes vasodilators, vasoconstrictors, as well as ions and chemical factors. Now looking at the vasoconstrictors. So vasoconstrictors, it includes the norepinephrine and the epinephrine, angiotensin and the ADH. So there are two A's. There is the angiotensin 2, as well as there is presence of the ADH. Next is there is a norepinephrine as well as epinephrine. Then comes the vasodilators. So vasodilators, it includes the bradykinin as well as presence of the histamine. So the vasodilators, it includes the BH, the bradykinin as well as the histamine. Next is the ions and the chemical factors. So ions and chemical factors, it includes the increase in calcium. Increase in calcium, it causes vasoconstriction. Increase in calcium causes vasoconstriction. Then increase in magnesium as well as the hydrogen and the carbon dioxide ions. So all these, it leads to increase in the potassium K+, then the magnesium H+, CO2 ions. So what it does, it ultimately leads to the vasodilation.
To learn and grow daily like this, please do subscribe.